Hi, my name is Dr. Paul, and I want to welcome you to this office, and I want to explain to you what my core philosophies are before we get started with treatment. I'm passionate about what I do. I really enjoy helping people because I help them regain their lives back again. I give them hope again. And that's my goal with all my patients, to help them take control of their health. If you watch some of the videos on my website, I encourage you to watch The Death of Modern Medicine, and that is really important to understand because my approach is to really get to the root cause of someone's symptoms. There's primarily three main symptoms or main core issues that cause problems of every single person that walks into my office. And I do a lot of muscle testing, which is very scientific, but it is out of the box. It's not understood by medicine in terms of traditional medicine. It is based on Eastern medicine. And for example, acupuncture is not really understood. The meridians have just recently, which are electrical pathways in our body, have just recently been proven. But it took many, many thousands of years for science to catch up with the fact that it works, and they've actually proven it. Just like they thought once that smoking was not good for you, and I mean smoking was good for you or was okay, it didn't cause any problems. Just like they thought that the earth was flat. There are so many things that they have proven now, and they have yet to prove, that has an effect on health. For example, radiation is a huge issue, and I'm going to be talking about this. So there's three main areas that I want to check on your body before we get started. And Eastern medicine has evolved into a muscle testing procedure, which a chiropractor developed about 100 years ago. And it uses specific reflexes on the body. Now I'm going to show you this on the body, but I'm going to actually do it on you with your approval on the computer, because it's a neural feedback system using a computer, because when I do it on your body, it's limited to one point at a time. But on the computer, I can ask up to 20 things at once. And basically, like I said, it's a neural feedback system. It's like a knee-jerk reflex. I use a reflex hammer on your knee, and your knee goes up. Well, the computer does a similar thing. It sends a signal to your hand using a brass pad, and it asks several questions at a time, and I get a reflex on the arm. And in my situation, the way I do it in the office, I use the arm to check for a neurological response sent from the computer. If it is positive, the muscle will give me a positive response by either loosening or the wall it goes past the wall. For example, if I check my arm like this and I get a positive muscle response, my arm, my hand, my checking hand, which is the left hand here, will move further like this. And that's a neurological reflex, and you'll be able to feel that when I do it on you today if you're here as a new patient. So there's basically 3 points that I check, and these are the source of mostly all disease patterns. And many people come to me for a difficult condition that they have never been able to get solved, and they don't want to depend on drugs, because if you take a look at the video on The Death of Modern Medicine, drugs really don't solve anything. They just mask problems, but they also cause a huge host of collateral damage to the body. In fact, each year there's over 100,000 people that die every year from prescribed medications that were properly prescribed. There's thousands of deaths each year from over-the-counter drugs, just from aspirin. So there's a big problem in America, and the problem really is the pharmaceutical industry. I'm not against drugs. I'm against the improper use of drugs. I've referred people out for drugs before. But when it comes to being dependent on those drugs, and the doctor saying to you, hey, listen, you have irritable bowel syndrome, you need to be on this drug for the rest of your life, and ignoring common sense, like how you live on a daily basis, as contributors to what you're going through, such as the food you're eating or gluten sensitivity. There's a whole host of issues. That's not common sense. And what I'm here to do is is a tailor-made approach for you so that you can find out through the testing that I do what is the cause of the problem and get to the root and do some lifestyle changes, because that is usually involved. If you want to get the best bang for the buck, for your buck here, is listen to my lifestyle recommendations, because if you don't supply your baseline health with proper foundational materials such as what you put in your mouth, the stress that you handle on an everyday basis, if you don't just do basic foundational things like get sleep, those are things that we have to address right in the beginning. So when most people come in, they come in with some kind of pain. I'm a chiropractor, but I'm a holistic nutritionist. I do neurology work, and I do things to handle whatever symptom you have. I don't want to put you under a label, and that's what drugs do. In fact, drugs were designed for symptoms, and diagnoses were basically a list of symptoms, and then you apply this drug to these lists of symptoms. Well, if these lists of symptoms, like irritable bowel syndrome, you have chronic diarrhea or alternating diarrhea and constipation, and your diet doesn't do anything to change it, they gave you a drug for irritable bowel. Well, now this drug causes these set of symptoms. Now you may have to make another drug for these set of symptoms, and it goes on. And now you've got no common sense, because what if the cause of the irritable bowel syndrome was not the lack of these drugs, which causes these side effects? You have to get to the root of irritable bowel syndrome, and so that's what we try to do. You're not a list of symptoms. I mean, you're not a diagnosis or a disease. Okay? You have the power to heal yourself if you give it the right groundwork materials. So these are the groundwork materials, and these are the reflexes on the body. You've got the brain or neurological component, things that would cause things like Parkinson's disease, ADHD, attention deficit disorder, autism, Alzheimer's, a host of neurological ailments that you can test for with traditional neurological testing, and you can test even with the latest urine testing to see for neurotransmitter health. That's neurological. Physical reflexes right here, and this is for things that chiropractic typically sees, and that's what most people come in here for, is pain. And sometimes they think, oh, I just need a good adjustment. Well, I find that rarely to be the case. I find that this is usually caused from a chemical imbalance, or well, if this is the point that comes up, this is truly a physical, like misalignment, or a surgical scar that has gone haywire on your body. I'll tell you a story about what happened with my with a 5-year-old boy. He was constipated so bad for more than a week at a time. He was throwing up his food because he was backed up. Well, he had an open heart surgery right here, and that surgery was right along the midline, which is an acupuncture meridian, or basically an electrical pathway that goes straight up and down the center of the body. And when you have a surgery there, that surgery is a trauma, and that trauma causes scar tissue, and that scar tissue blocks the energy flow in the center of your body. And based on Eastern medicine, the center, which has been proved scientifically, by the way, as you can recall, these meridians have been proven by Western science. The center pathways are the most significant effect, or are very critical to your health. They control other pathways. Same thing with your spine. That's the center pathway. Well, in his situation, the scar was causing the problem. I treated and did acupressure on the scar, and his constipation went away. So that's a physical issue. So we got neurological, physical, and then the third one is biochemical or chemical imbalance. And this is what I find most of the time for people that come into this office for whatever symptom they have. Back pain, neck pain, headaches, any kind of physical pain. But if they come here for something else, this is usually what's causing it, more than 95 to 99% of the time. So there are tests you can do for biochemical imbalance. One of the reflexes that I check is the vitamin D test, or the vitamin D reflex, which is right over the ribs. That test I've been able to prove and validate with lab work, blood work, 100% of the time. It's been accurate. When I find that reflex, I have them go get their blood test, and it's 100% on. That means that when I find it, they're going to find it on the blood as well, a deficiency. So that's the scientific part of it. I can repeat it over and over again. It's a muscle test, but I am able to verify it with a blood test. So when I do chemical testing, those things can be verified, some of them, but some of them cannot. And I'm going to give you an example of radiation, like Wi-Fi, stress, radiation from antennas, from cell phones, from any type of electrical atmospheric energy patterns that affect our body, which has never ever affected our bodies like they do now, because we are so exposed to these frequencies in the air. I find that very commonly a problem, especially for autistic kids, but it affects us too as well. It just affects autistic kids more because they have all these symptoms. Well, for us, it can give us more stress, emotional stress. So I try to shut things down as much as possible. So you can't test for that. How can you test if radiation is affecting you? You cannot. There's no medical test that I'm aware of. Maybe one day they'll find a test that you can actually prove that you're being affected by radiation from the air, but I'm not aware of it. But things are coming in the forefront, and there's more tests being done all the time. The other thing that you can't test for is things like infections or heavy metal toxicity that's not currently able to be measured by current modern technology. For example, blood tests, you can measure mercury in your blood, but mercury doesn't want to stay in your blood. For example, your blood is required to have a certain very specific pH. If it veers just a little off of that pH, it will buffer the blood to get it back to that 7.2 pH. Well, mercury and infection will do that. It will cause your pH to go askew. Well, what does the body do? If the body is healthy, it'll get rid of that mercury quickly out of the 4 exit points. It could be you either poop it out, you pee it out, you breathe it out, or you urinate it. Either pee, you poo it out, you breathe it out, or it comes out through your sweat. You sweat it out. So if you're healthy, it will do that. But if you're not healthy and you've got too much mercury in your system, and I'll give you an example of an autistic child again. Some autistic children have this thing called a pyrrole disorder, which they excrete out pyrroles, and it's called pyroluria. And what happens with that condition is that they pee out all their zinc. And zinc is a very necessary nutrient to process so many different chemical reactions in your body, and one is to fight heavy metal toxicity like mercury. Well, if they pee out all their zinc, they accumulate mercury in their body. The 4 exit points, pee, poo, breathe, and sweat, cannot handle the amount it needs to excrete. There's only one thing that the body can do. It stores it. So now it's stored in your fat, and that's where the common place is. And so there's no tests for that. You can't test the amount of, well, there is. You can actually do surgery. You can actually do biopsies and test the amount of mercury in the connective tissue in the fat. But where are you going to do the biopsy on? Everywhere? There's no reasonable way to do biopsies on multiple places to find mercury. There's none. That is where we have to go to out-of-the-box testing, like muscle testing. And in my office here, we do a highly advanced computerized technology. You hold a brass pad in your hand, and we send a signal from the computer with a very micro amount of frequency to your hand. You won't feel it, to query your body. We talked about this already. And it will respond positive with a positive muscle test on the arm. In this case, I use the arm. There's multiple ways to test using muscle testing, and I use the arm. That has come to be very accurate because it's proven to work on so many patients, thousands of patients that have gotten these muscle tests and gotten results with multiple different chronic diseases. I'll give you an example of a patient that came to my office that actually came to sell me a line of facial products or skin line that she wanted me to carry in my office, and she knew what I did. I was a holistic practitioner, and she was interested, and so I said, well, let me just do a quick scan. I had no history, had no idea what was her symptoms. I checked her, and I found that over her uterus point, I found some kind of potential infection. It doesn't diagnose any infection, but it diagnoses, and I don't diagnose with muscle testing. It just gives me that there's some kind of imbalance in the area of the uterus. There's like a short circuit there. Well, it turns out that I told her, you may have some kind of infection and you may have a hormonal issue there. And she goes, you're exactly right. It took me like 3 minutes to figure that out. She has an infection. She's been having a history of green discharge in her vaginal discharge, and they recommended that she receive a hysterectomy. They recommended a surgery. She didn't want to go that route. She didn't want to take hormones. So I just put her out basically on some natural nutrition, and within a month, most of her symptoms went away, and she didn't have to have a hysterectomy. Well, I found that all with just muscle testing. And so when you come to this office, I'm going to be doing that. And if you have pain, just realize if you want to get the best bang for your buck, I have to do muscle testing to figure out what the cause of that pain is. I can do chiropractic and I can adjust you. You can go to any chiropractor to do that. You can get muscle work done, you can get a massage, and maybe that'll take care of the pain for a short period of time. But if that may be just a temporary solution, it may just come back and it won't really get you healthy and keep the pain gone for a longer period of time, maybe for good, if I find the cause of the problem. Because if it's not physical, like we said in the beginning, causing your pain like a misalignment, I can adjust you. It may even give you relief, because an adjustment releases natural pain-relieving chemicals in your body. And so you go, oh, that worked, but the underlying cause was not really addressed. It's like just band-aiding the problem. Well, I can do that, but if you really want to get the most out of today's visit or any visit, then you come in is I need to do muscle testing on you. That's one of my core things that we do. And so if you have any questions, feel free to talk to me, and I will talk with you very soon.